All right, everyone, for our next segment, really excited to bring this, especially, with my background in strength and conditioning to complement athletic training. I always love when I hear a talk from a PT and or an athletic trainer really talking about the strength and conditioning side of things to take our rehab to the next level. And I'm excited to share right here, Rob Panariello and Angelo Marsella. They are with Professional Physical Therapy, and they were the presenters at the NYSATA NYSATA conference in 2022 up in Schenectady, and really excited to talk about the key takeaways from their program, Athletic Performance Training Program designed for lower extremity return to play testing. Rob is the chief clinical instructor and the founding partner of Professional Physical Therapy, and Angelo is the director of sports medicine for Professional Physical Therapy. Fellows, it's great to have you on. Thanks for being here.
Thanks for having us, Roy.
Absolutely. So let's get right into some of your key takeaways. And I'm really excited to talk about this. You mentioned the influence of Vermeil and his hierarchy of athletic development. Give us a snapshot. What was it about that hierarchy development that really got you interested in this? And then how did you and your team work to modify it for rehab in the current way that you use it right now?
Well, Al's been a friend and a mentor for over 30 years for me. And he's done a lot. He's come down, spoke to our company, et cetera. He's a very successful Hall of Fame strength and conditioning coach. And it's just a system, right? It's just a way to go through a progression. So if A, progress to B. And so we took that system, right? And we needed to adapt it somehow, because if you think if exercises, program design, philosophies create the fastest, strongest, most powerful athletes in the world, and why can't we take the same principles, even the same exercises, modify them, right? ATCs, PTs, we're fairly intelligent people, and bring them in the clinical setting. But you need to have some type of foundation and philosophy of progression. And that's what it was. And so obviously doing rehab's a little bit different than strength and conditioning. So we added the components of rehab that we felt were appropriate in that same philosophical design. So that's kind of how we did it.
I appreciate that. And when you talked about the modification for rehab, you talked about the timelines that you use and the really specific strategies that you teach to your team. Before we get into the qualitative movement assessment, which I'm sure is a part of that, it's to supplement that. What are the key takeaways that when you're telling your team for utilizing that system, that hierarchy of athletic development, what do you think are the most important aspects of implementing in that rehab aspect?
I think that each component is dependent upon the optimal development of its predecessor or elimination. So, you're not going to really lift heavy weights if you have a lot of pain and edema, right? So those are some noxious stimulus that you have to resolve. And obviously, you need mobility. You need the muscles to be firing before you can really exercise appropriately. So again, you're going through a progression. When you're checking off this box from going A to B to C, et cetera. You can, once you get to physical qualities, you can train all physical qualities simultaneously, whether it's preparation for advancement, but the emphasis has to be on the biggest deficit. And, you go from there. So.
And I love how you speak about that again, the hierarchy, the foundation. If you don't address those things, it can come back to bite you later on. And we all, we want to get to the fun stuff. The athletes, the patients want to get to the fun stuff. But if you don't work on that foundation and build that solid root for what you got to build on top of it, then you're going to end up with flaws and deficits that are sort of hidden down the road. And I love how you made that emphasis. And that's sort of where the QMA comes in, right? To really look for those deficits and to identify what might be hiding, what might be obvious, but also what might be hiding. Let's tell us about this qualitative movement assessment that you've created. Why'd you create this and how was it developed?
And you want to?
Yeah, sure. So the QMA was designed to reveal any deficits or imbalances that may put you at risk for re-injury. And it honestly came together, but we worked closely with one of the doctors in New York City who, wanted to learn more about the re-tear rates in ACLs. So, we worked together and we developed this program on the same basis as, Vermeil's hierarchy and that pyramid that Rob described. And it works hand in hand, to be honest with you, going from mobility as the foundation to strength, explosive strength, elastic and reactive strength, and then speed. So we developed this, and it's typically we do these for ACLs typically around a 6 or 7 month mark of rehab. And it's been pretty eye-opening, and it's only a tool. And I don't want everyone to think that this is the be all end all. This is just the tool that we use to give some feedback to not only the patient, but to the MD on how that progression is going.
I appreciate that. And let's walk us through a little bit what that looks like. So let's go through those segments and maybe give, 1 or 2 examples of tests that you use. Let's start with the mobility section.
Sure. So the mobility one is, we have a couple of different things that we do there. That when we assess the student athlete, and the first part of the mobility one is, we'll do some alternating butt kicks, right? So let me back up. Actually, we start off with some active and passive range of motion. We'll use the goniometer, and we're looking for some type of. We usually look at between like 125 and 135 degrees of range of motion. We'll do that actively for knee flexion. And some ways we assess it is we do alternating butt kicks, basically just having, the patient standing against the wall and just kicking their butt. And then I'm a big video person, and I'm a big proponent of showing people or showing someone what they look like when they're doing something. So it gives not only myself feedback, and it gives them feedback as well. And they can review it and see what it really looks like on the third eye there. So we'll use alternating butt kicks to checking out their, the knee flexion. Overhead squat, we'll do. And that's something that we just do with a simple dowel, when we just basically just have the student athlete or the patient holding that bar or a dowel over their head, and then just doing a squat. And we're looking at a bunch of different things. We're looking at if there's any weight shift. How deep are they going? Are their ankles coming off the ground? Things like that. Is their trunk forward flexing? That really identifies a lot of issues that may happen with them when they're going through their rehab.
And then go into that next segment. Give us an example of what you're checking in the strength segment.
Yeah, so strength is obviously, we're looking for, true body strength, lower body strength, and we'll assess it by doing 3 different exercises. We'll do like a trap bar deadlift, and we have different. And that's obviously just lower extremity strength. An 8-inch forward step down. That's helping us see how their eccentric quad control is, glute strength is, their balance, their core strength, and then we'll do a reverse step down from a box. And again, that's showing the eccentric quad control as well.
Yeah, I think what's important, Ryan, is that when any test you're going to use for an evaluation with your athletes, you have to minimize the skill level. So the reason why we use a trap bar deadlift, it's easier to teach, it's easier to perform than a back squat or a front squat, especially if someone's never performed that exercise before. So by minimizing the skill, you're going to get more of a contribution through the quality. Your deficit's not going to be due to lack of skill. And I think that's important. And the other thing with the trap bar deadlift, what we found, especially with the females, as they start to lift heavier loads, it's not a deficit of the lower extremities. Sometimes grip strength is lacking. And so sometimes you may have to use straps. So, there's difficulty holding the bar with some individuals, not leg strength, but grip strength. So you have to look out for that as well.
I appreciate that. And, when you talk about keeping it simple, the more complex you make a test, the more there's a learning curve, like you said. So I'm glad you brought that up. I love trap bar deadlift. You can tell a lot from it, and it does simplify it absolutely compared to a back squat or a goblet squat or a front squat. So good stuff. All right. What about, let's go explosive strength.
Yeah, so explosive strength, we like to utilize, again, for time restrictions alone and ease of getting through teams, especially large teams. We use a jump mat for vertical jump. We'll do double leg vertical jump testing and single leg vertical jump testing. Again, that's just showing us what their double leg power is. And then the single leg will show us the difference between the involved versus the uninvolved. And then, we're usually looking for about 90% limb symmetry. We'll do a standing long jump as well. Again, that's just showing double leg power, and we'll do that double leg and single leg as well. And then we'll do a lateral push off to see for distance, to see how much power they can generate pushing off that involved versus uninvolved side.
Great stuff. And I also love to compliment that explosive strength in your presentation. You really made an emphasis not just on the takeoff, but on the landing of all of those, looking for that eccentric dynamic control. So I'm glad you spoke to that as well, because that's just as good. You can't go 60 miles per hour down the highway if you can't stop with the brakes. So, so that's definitely good stuff. All right, elastic and reactive strength now.
Yeah, so reactive strength is obviously something that we use to address or assess how much time a patient spends with their foot on the ground, right? So anytime you're running, you want to be efficient with your running patterns. So, we do this again on an 8-inch box and a 12-inch box, and then we do this with double leg reactive strength, and then we do it with single leg reactive strength as well. We do multiple jumps and single jumps again, just to assess how much time they're spending on the ground. We'll also do a lateral bound, Ryan, as well, similar to what we did with the strength portion of it. Again, just assessing how quickly they can go back and forth off that foot.
Great. That goes right into speed then. You put
Yep.
it all together. What are we doing to test speed?
Yeah, so speed, obviously we'll do like a 10-yard, again, videotaping it all, and we'll do like a change in direction. We're looking for a bunch of different things. We're looking for, how's their posture? Are they, we're not looking, we don't want that upright posture, but when they're cutting, how's their trunk control, deceleration, and a good athletic stance, and there's no valgus going on in the knees there. So we'll do that both right and left, like a 10-yard sprint, and we'll have them change, plant off the right leg and once plant off the left. And again, videotaping to show them what they look like, and then slowing it down and really getting a good look on what the knee's doing.
Great stuff.
And if you
Rob,
look,
anything to add to that?
yeah, if you look at the testing, the reason why we test that way, the testing correlates to the hierarchy, right? A strength test to progress to the power test, to progress to the elastic test, to progress to speed. So in the same way of training, we also use that correlation for testing. And the other thing we do is we try to keep it simple to more complex. Because if you think about rehab, sport is high load, high velocity, right? And rehab, we start at lower loads, low velocities, and we have to progress to high load, high velocity with some type of system. So we'll go 2 legs before one, right? We think of simplicity to complex. When we test or we train, 2 legs before one, slow before fast, linear before change of direction, right? They have to demonstrate the ability to do the simpler task before we can progress them to the more complex task.
That's a great point to tie this all together, and I love how you just tied together the key to performance, the key to athletic development, with how do you find gaps in it to make sure that your rehabs are progressing, and how do you modify it for those that have had an ACL injury or another significant lower extremity injury. So thank you so much for your time. Really enjoyed your presentation. Your contact info is going to be in the show notes here if anyone wants to follow up with you and reach out. But thank you so much for bringing this up in the world of athletic training.
Thanks for having us, Ryan.
Hopefully see you in Philadelphia, Ryan. Have a good one, bud.
Have a great day.
See you soon.